Hi, welcome. My name is Karen Przybylski. I've been a licensed acupuncturist and traditional Chinese medicine practitioner for over 15 years, and I've been practicing functional medicine for almost 4 years now. I love what I do, and integrating Chinese medicine with functional medicine has been a really fun and rewarding experience. I was very dedicated to digestive health from the very beginning of my practice, even dating back to my very first pediatric digestive patient while in Chinese medicine school. So it's really wonderful to see this integration of medicine coming into its own right now. We're seeing a lot more people like you seeking out more alternatives to the Western medical paradigm, which is great. As I said earlier, I've been working with digestion problems since day one. I had some of the best teachers in the business, so that means I know a lot, and I'm passing all of that information down to you. This information has been around for generations. I'm just trying to educate people about all of this as much as I can and put you in the driver's seat of your healthcare journey. So, this information is usually limited to the stuff that you would hear in an appointment with a naturally oriented practitioner like myself. But now we have the internet, so we can talk about this stuff more openly, even if you're not in an appointment with me, which is wonderful. My training originally was in Chinese medicine, although my first teacher was a Chinese medical doctor, and my second teacher was a Chinese herbalist. My third teacher was a naturopath, and my fourth teacher was a chiropractor. So, functional medicine has always been a mix of different practitioners doing different things. A huge number of people want to do this work in terms of patients, and there's not a whole lot of trained practitioners. So, I'm just trying to fill the gap with these educational videos so you can decide for yourself which type of practitioner you should be seeking. Today is going to be more patient centric for people like you or those that you know who have GI symptoms. We're going to talk about GI symptoms and how that's related to what I call the big five. We're talking about the warning signs, what causes the symptoms, an overview of some of the nutrition that's related to all this. And at the end, we'll have a case study, which hopefully you find fun because I'll show you what the labs look like and how this all works. So, the most common GI symptoms that we see every day, and there are literally millions of people that have these problems: acid reflux, nausea, cramping, gas, bloating, constipation, and diarrhea. Some people have one of these symptoms, some people have symptoms that come and go, and some people have all of these symptoms at the same time. So, as you'll learn in today's lecture, the symptoms are important to the person who's suffering, but the symptoms are almost irrelevant in the functional medicine system of analysis. And I'll explain what I mean by that in a minute. What we're basing our analysis on is the labs, lab testing for adrenals, gut, and everything that we can possibly test for. It usually includes an organic acid test as well. And the reason we test is because not all people who have digestive problems have digestive symptoms. In fact, 50% of people with gut infections have no uh, digestive symptoms whatsoever. They have systemic symptoms like headaches, skin problems, brain fog. So it's not just limited to GI symptoms. So that's really what the core of what we're doing here is lab testing with functional medicine. And then we combine that with diet and lifestyle coaching. We have these two big variables, the lab testing and the diet and lifestyle coaching, which really are our two main treatment options. Just like a conventional medical doctor would have the choice of drugs or surgery, we have the choice of functional medicine labs or the lifestyle changes that we all need. When we combine those two together, people do extremely well. So the big five is a summary of what are the five most common complaints that I see in my practice. These are not unique to my practice. These are common complaints that we see all over the place with people. They're weight gain, fatigue, depression, hormone imbalance, and digestive problems. The interesting thing about this is that it's very rare to see someone that just has digestive problems that doesn't have at least one of the other variables. It's very rare for a digestive problem to just be there by themselves. Usually, if you have a digestive issue, you're also going to have problems um, with one or more of the big five. So some people have all five of the big five. Some people are overweight, tired, depressed, have a sex hormone imbalance, and have digestive problems all at the same time. So we live in this drug-oriented culture where we try to drug problems in a really aggressive way with many drugs that have a lot of side effects. The whole point of today's talk is to show that digestive problems can underlie any one of the big five issues. If you're overweight, tired, depressed, or have a hormone problem or a digestive problem, it could be directly related to your digestion. That's a basic fundamental naturopathic principle. So the causes of big five in functional medicine, what are they? I look at these causes on a systems level. The systems I use are what I like to call the Digestive Health Center method, taken directly from my teacher, Dr. Kalish, and we've made it really simple. Three systems: hormones, digestion, and detox. If you have a breakdown in the hormone system, that's going to weaken your gut lining and lead to digestive problems. Obviously, if you have a digestive system problem, you're going to have digestive symptoms. Also, if you have a detoxification related system problems, you can have digestive problems from that as well. So, when we look at triggers, the number one trigger that we see is emotional stress. Number two is dietary stress, and number three is pain and inflammation problems. The number one trigger for digestive problems is emotional stress caused by grief or loss of or loss, like major event life, losing your mom, losing your job, having a divorce. Um, so this isn't just limited to what's happening in your life right now. This could be something from childhood, like childhood trauma, parents' divorce, the death of a loved one, etc. So for some of us, the emotional stress dates way farther back into our health history. The big takeaway here is that there's enough emotional stress that the hormone system starts to weaken, cortisol level starts to drop, and the gut lining starts to get damaged. Emotional stress is the most common pattern that we see that generates digestive problems over the long term. Once you have a digestive problem that was generated from emotional stress, now you have stress plus a digestive problem. So we have to correct both. In the case study that we have at the end of the class, I'll show you how we test and correct for stress hormones and reverse the effects of chronic stress, how we test and correct the gut in an integrative program. We're never treating one symptom, we're never treating one body system, we're treating the totality of the person. I personally don't like to use the term holistic because it doesn't really describe functional medicine in practice very well. It's really like a practical fundamental approach. If you were buying a new house and you noticed that the doors and windows were all crooked, you had a contractor come in and say to you that the foundation is tilted. It's not a crooked doors and windows problems. We just have to fix the foundation. Then all the upper story problems are going to go away. That's the same concept in functional medicine, is that we have these foundation or core issues. When we fix these core issues, like when a contractor fixes the foundation of a house, then all of a sudden the doors and the windows open and close properly. You wouldn't call that that contractor holistic. You would say that's a good contractor because he figured out there was a foundation problem that was triggering all these other issues. So digestion is the core foundation problem in many health problems. In the Chinese medicine world, which has been around for thousands of years, it's the center of gravity for us to contend with because it triggers all kinds of other problems, as we'll see shortly. The secondary trigger would be dietary stress, and we'll go through some of the different variations on that in coming up here soon. The third area that can trigger digestive problems would be some sort of chronic pain or inflammation or even hidden inflammation. So emotional, dietary, and inflammatory stresses all contribute to problems with the adrenal glands. When the adrenal glands start to burn out, we start to develop digestive problems pretty consistently. There is an adrenal digestive component, and I'll have another video if you haven't heard about the adrenal glands to help tie that in for you, but we're not going to go too far into that because this is focused on digestion. Then you have a hormone component to digestive problems, very strong brain-gut connection. Or gut-brain connection. Either way you want to look at it, it's a feedback loop, brain to the gut, gut to the brain. What that means is when the gut is under stress, it causes problems with the brain. When your gut is inflamed, the brain gets inflamed and damaged, and neurotransmitter levels drop. Typically, they drop. When the brain is under stress, that impacts the gut. If you're going through a divorce and you're trying to raise 3 kids by yourself and you're stressed, the brain and the adrenal glands get out of balance, and that has a negative impact on the lining of the gut. Emotional stress by itself can trigger intestinal permeability and digestive problems. It can work the other way too. If you go on a trip to Egypt and you get sick from drinking some bad water and your gut gets inflamed, that will cause problems with your cortisol, problems with your brain, and you'll have a gut brain or gut hormone related problem that was mediated from the gut being the trigger. All these things are interactive, and we usually try to find out where the original problem came from. Although in some ways it doesn't matter because we treat all of it together, but it's nice to know what the original trigger was. You could be depressed because your gut is not working, and we see that commonly. You could be anxious because your gut's not working. And if you're anxious or depressed, that could cause problems with your digestion. It's a two-way street. There's this feedback going back and forth from the brain to the gut and the gut to the brain. It should not come as a surprise if a person gets a person's gut gets better and their depression or anxiety goes away. It's a very common finding that I see in patients all the time. GI warning signs are the obvious things to look out for: constipation, diarrhea, IBS type diagnosis from a conventional doctor. You might have a lot of inflammation that would manifest as joint pain, muscle aches, pain, fibromyalgia type of pain. You could be anemic, you're not absorbing iron well. It could be increased seasonal allergies or food allergies or sensitivities that can all come from intestinal permeability. You could be tired all the time, or you could have a lot of immune related problems. That list is obvious, but what's not so obvious is the hardest thing in working with the gut. Really hard to sink in that a large number of patients that we test that have significant digestive problems have no digestive symptoms at all. Let's take a deep breath and think about that one. I know I said it earlier, I'm just going to say it again. At least half of the people that we test that have raging digestive tract infections and other digestive tract problems don't have any digestive symptoms that they're aware of. How can that be? That's the way our body works. You could have some really severe digestive tract problems and be completely unaware of them. And that is one of the biggest problems in TCM and functional medicine. If we don't do the lab work, we will never find this out. Every single new patient that I work with, we always test the gut, because you would be coming in and say, I have no digestive problems, but I'm depressed. I have no digestive problems, but I'm anxious. We run a test. We see that there's a bug in your gut. We fix the bug, and all of a sudden the problem goes away. This is a fundamental concept of functional medicine. We're not basing our decision on symptoms. You have a problem with an organ system. We commonly see this with a digestive tract, 2 or 3 problems and no obvious symptoms of it. If you're fortunate and it's an easier case, then of course you'll have digestive symptoms along with your digestive problem. But that's not always the case. Like I said, 50% of the time, there's no symptoms. So we want to be optimistic and start to look at what a healthy digestive system looks like. And this is the schematic for that. You have healthy intestinal villi. You can see the intestinal cells are pretty amazing structures. They have this whole complicated structure where part of the cell is sticking up. Think of it as shag carpet from the 70s. If you're old enough to remember what shag carpet is, that increases the absorptive capacity of the intestinal tract. I just read this a few days ago. The lining of the intestinal tract has 200 times as much surface area as the lining of your skin. It's a very large surface area because all these little projections are sticking up everywhere. You also have these intestinal crypts. These are structures that go down as well. The architecture of the gut is pretty profound and quite complex. When it's healthy, it works well. These finger-like projections or villi that stick up help us absorb nutrients, and they're really critical for our well-being. So what would cause things to go bad? Emotional stress, dietary stress, or some kind of inflammation, or all three. If you have emotional, dietary, inflammatory stress, the normal finger-like projections that stick up start to get blunted or damaged. Now they're not sticking up as much, so you're not going to absorb nutrients well. If you're having really bad times and your gut lining is incredibly damaged, then you can have what they call villus atrophy, which means that finger-like projections are gone now, and that's pretty serious. It's not very common, but it's also not too rare in patients that I work with. Most patients are suffering from some damage, but not complete destruction of the villi. When the villi become more damaged, the current term for this is intestinal permeability or leaky gut. It means that the gut lining is no longer competent. It's like a garden hose. You take an ice pick and punch a bunch of holes in the hose. Now you turn it on and it's leaking everywhere. So what happens when you have leaky gut? Bad stuff leaks in and you're not as good as absorbing healthy nutrients because those villi are blunted or damaged. You have a double-edged sword here. You're not absorbing the nutrients you need well, and you're absorbing a bunch of stuff that you shouldn't be because food antigens, heavy metals, and all kinds of things are leaking into the gut lining. You're not being good at being selective about protecting yourself from these problems. The more stress that you're under, the leakier the gut gets, and the more likely you are to develop all these other symptoms. A leaky gut doesn't necessarily manifest as gut-related problem. This, again, in functional medicine, where symptoms don't always line up with the underlying cause. With leaky gut, you could have weight gain or inability to lose weight, also known as weight loss resistance, joint pain, eczema, skin rashes, hives. Nothing in that list is about your gut. You could have an autoimmune disease. In fact, most autoimmune illnesses are accompanied by leaky gut. You can have chronic fatigue or depression, all caused by leaky gut. Asthma, hay fever, airborne allergies that clear up when your gut gets better. This happened to me when I was in my 30s. I've always been big on camping and hiking. I can't imagine life without it. I've never had a big camping trip. It's always a bad camping trip. It's always been a good thing. So in my 30s, I was doing a lot of hiking and camping in the mountains of Colorado. And I was starting to get really serious stomach aches and couldn't handle any stress, even the tiniest bit of stress, which for me, being in my final semester of Chinese medicine school, was really inconvenient. I just couldn't handle any stress. It had gotten to the point where it was so bad I could barely leave the house. For me, this is catastrophic because I was losing energy, time for work, school, and friends. I went to see a gastroenterologist who did a bunch of functional stool tests, and he said to me, "You've got this really bad digestive tract infection." He gave me Flagyl along with these herbs, and within 2 days, I was completely better. I had suffered for months, and in 2 days, I was completely better, which was really important because I had an internship in Beijing that I needed to get to a week later and really didn't want to miss it. So when I was in China, the herbal doctors there gave me more herbs and I felt so much better than I had in years. My lifelong seasonal allergies had cleared. My digestion was regular and consistent and predictable. I was able to hike and walk all around Beijing. I felt so good. I was back and it was a minor miracle. I didn't have any stomach problems whatsoever. I got rid of the gut infection, and in my case, it was Giardia. It reduced my load on the immune system. My allergies disappeared, what seemed like almost overnight. So you can see there are leaky gut symptoms that are related to the gut: gas, bloating, constipation, diarrhea, or heartburn. But don't get fooled. You could have a symptom that indicates you have leaky gut, even though it's not related to your digestive tract whatsoever. It's not symptomatically oriented care. And that's the hardest thing to wrap your mind around because we're so used to associating symptoms with problems and symptoms with solutions. So, triggers associated with leaky gut. We already talked about emotional, dietary, and inflammatory stress. It could also be related to lack of sleep, toxic chemicals, too much or too little exercise. If you exercise too much, you could cause leaky gut through all of the cortisol that's released while you exercise. If you don't exercise at all, there could be a problem as well. Gluten and dairy sensitivity, we'll get into detail on that in a bit. But food allergies, suppression of your immune system, all kinds of things can be triggers for leaky gut. There are three critical stages of leaky gut, and we can find ourselves in this process if we're having any kind of chronic health problem. It tends to start with the local GI symptoms. You might have heartburn for a little while, and then the heartburn goes away, or you take a drug and the heartburn goes away. You don't realize that the problem is still there and it's getting worse. Then all of a sudden, it's 5 to 10 years later, and you're starting to develop autoimmune reactions, or you get headaches, or it's not that you have allergies once in a while like you used to. Now you have joint pains that don't make a lot of sense. So things are getting worse, but you're not associating that original time when you had these allergies with the current moment when you're in all this joint pain. It's not something that you're intuitively going to connect together. Then if that progresses even more, you can have a full-on autoimmune disease. You can have Hashimoto's or something where now it's progressed to a serious medical problem that may require drugs or some kind of medical intervention. Leaky gut is a really slippery slope. It tends to get worse over the decades, not overnight. Over the course of 10 to 20 years, we see this progression in the stages of leaky gut where eventually can end up being a problem that you have to treat. We're all in some sort of process of the gut being damaged or the gut being repaired, and you just want to be on the repair side of that equation. Certainly, if you're getting a lot of damage, you want to reverse it, right? This is also a reason why a lot of these symptoms come as people start turning in their 40s and 50s, because it does take 10 to 20 years for this to really fully develop and manifest into problems that you can't ignore anymore. So one of the most common things that we see that's an easy thing to correct would be changing your diet. If you have food allergies or sensitivities, in a way, it's a blessing because it's within your control. And I'm not talking about food allergies like peanut allergies and things that need EpiPens. I'm really talking more about sensitivities and intolerances. You don't have to take a drug to correct these food sensitivities. There's no surgery for food sensitivities. It's simply eating differently. That's the whole treatment. As your gut gets more and more leaky and the villi get more damaged and there are bigger and bigger holes in the gut lining, you're more and more likely to develop food sensitivities. Allergies and sensitivities can eventually lead to addiction and cravings, which is crazy. It's not something you would think of. People end up starting to crave the very foods that they're reactive to, which means that they eat them more and more, which means they get more and more leaky, and it's this endless cycle. So if there's a food that you crave, you should be suspicious. It's possible that you're reacting negatively to it. The number one culprit is gluten. We see gluten sensitivity all the time. If you have not yet done a gluten-free diet, just try it, just for fun. I know it's popular and kind of like a fad thing to do. 15 years ago, when I was doing gluten-free diets with my patients, no one had ever heard of it, but we've probably heard a little too much of it now. It's even on TV and people make fun of gluten-free, right? But I still suggest that you try it for a couple of weeks because it can make a huge difference. It's not just a fad or a trend. There's a reason why people are benefiting from the gluten-free diet. The second biggest evil after gluten is sugar. If you've never had a year without sugar, then you have a problem with sugar. If you've never had a year without heroin, then probably would have a heroin problem too. It's that addictive. Sugar is so highly addictive, as is heroin, cocaine, and alcohol. It's right up there in those class of addictive substances. So sugar, in my mind, should be something that we enjoy when we feel like it, but should be a take it or leave it kind of thing. You can include it in celebrations or special times, but it doesn't have to be something that we eat every day. If you're craving it and can't stop, then you have a serious problem. Sugar addiction is really difficult to break. It runs in families. It's often something that people pick up when they're young. Sometimes people are overweight when they're eating a lot of sugar, sometimes not. It's embarrassing and it's hard for people to talk about it openly because it seems like something that you should be able to stop. I've been a sugar addict for many years in the past. There were summers when I would eat a pint of frozen yogurt every night. I never gained a bunch of weight because I kept up my walking and yoga and stuff, but it certainly was not good for my health. And there was a time in my life where I felt like I couldn't fall asleep unless I ate some sort of dessert or chocolate. If you're in that boat, I strongly recommend Cosmic Bliss dark chocolate coconut ice cream, but we're trying to break out of this pattern. So the general rule of thumb is that a year without sugar is great. If you can't even get by a week or two without sugar, then you have a serious problem. I don't think we have to avoid sugar forever, but you should be able to cut it out without such a mental need for it. So why am I talking about sugar so much here? Sugar is really highly addictive because of how it affects our blood sugar. And to make matters worse, it can also lead to candida overgrowth. Another very addictive component in our food is called gluteomorphins. So gluteomorphins are morphine-like compounds that come from the breakdown of gluten. It's a different kind of addiction. Sugar addiction tends to resolve revolve around blood sugar and candida overgrowth. Addiction to gluten and the difficulty of going on a gluten-free diet tends to revolve more around gluteomorphins. When a normal person eats gluten, it doesn't have an effect on their brain, and that's profound. If you're sensitive or intolerant to gluten, if you're celiac or the different levels of spectrum of gluten sensitivity, then you get a release of these gluteomorphins. The gluteomorphins go to your brain and they stimulate the pleasure receptors of the brain. These people who eat a piece of bread and all of a sudden they eat 5 pieces of bread and they can't stop, or they eat a whole bag of cookies, it's an addictive problem. And what's happening is your brain is being stimulated from these chemical compounds. It's impossible to stop eating gluten for these people. You need a lot of coaching and counseling to get through that. So I have a teacher who works very often with eating disorder counselors and with people who have severe addiction problems. It could be anything from anorexia to bulimia or overeating. It's important to know we don't look at this as a moral problem, which I think is the stigma that's attached to this. It's not that people want to overeat or want to be overweight. We really see it as a physiological problem. We want to deal with the physical biochemical solution first and then work with the emotional and spiritual issues that have to go or that go with eating related issues. So why I bring this up now is because you have sugar or gluten addiction, or you kind of can't cut out dairy, or you're going to just continually sustain damage, and you'll never be able to fix your gut unless you can clean up your diet. And so this never-ending cycle really needs a lot of help and a lot of support. We always have to deal with food addiction as if it's presenting. The person in this field for food addiction, the best person, is Lynn Harding. In Lynn's words, the definition of food addiction is a chemical dependency disease. It's not a behavioral problem. Nobody wants to eat sugar or gluten all the time, and nobody wants to not be able to stick to a healthy diet. People don't sign up for that. It's a chemical dependency problem, much like alcoholism or drug addiction. The chemical properties of food can cause all kinds of strange behaviors. Anyone who has a young child and has given them a big piece of chocolate cake and ice cream at a party has seen this firsthand. We get a little strange when we eat certain foods, especially gluten, dairy, soy, and sugar. They have really strong effects on us. Another effect of food addiction is going to be that they burn out the adrenal glands. They're going to damage the gut lining tissue. And now we're right back into this whole problem of leaky gut. If you can clean up the diet easily, great. But if you can't, then we want to make sure that we address all of these food addiction issues. For people who have food addiction problems or are struggling with changing their diet, we like to focus on diagnosis and treatment. We check for gut-related problems, we fix the adrenals, and then once the physical platform is in place, we start to work on the emotional and spiritual piece of all of this. If you are in this position and you're doing some kind of extreme calorie restriction diet, it's probably going to make you worse. So we want to be careful about protecting against that. When I think about the big picture stuff, there are two major things that we want to control in gut-related programs and digestive problems. One is the pathogens, and the other is food. You want to get away from all the foods that are triggering inflammation and damaging your gut, and you need to test to see what pathogens are present and eliminate them. Sugar and candida have an overlap because sugar causes the growth of this organism called Candida albicans. Everyone in the world has certain amounts of candida organisms in their system that can be fine with no problem. But if the candida overgrowth gets extreme, you're going to need sugar to fuel the candida, and you're going to crave sugar. At the same time, you can create a candida problem by eating too much sugar over a period of time, which many of us have done. For example, when I was eating my pint of ice cream every night because my brain chemistry was all messed up and I couldn't calm down without sugar, clearly I created a massive candida problem in my gut because that sugar was feeding these yeast or fungal organisms, and they're going to grow and proliferate. It's like if you're brewing beer and you put in some molasses, or if you're making wine and put the grapes in, the yeast is going to feed on the sugar from the grapes or the molasses and grow. When we eat sugar and we have yeast overgrowth, we're turning our gut into a fermentation chamber. In fact, you're actually develop some of the chemical compounds that you would develop from consuming alcohol if you have a really bad yeast overgrowth. People actually get this brain fog, hungover type of feeling like you had too many alcoholic drinks. It's the same exact chemical reactions happening in the body with yeast overgrowth as it is with alcohol metabolism. The big picture with the gut, we're worried about infections or overgrowth and food reactions. These are some of the symptoms of candida overgrowth: fatigue, white coating on the tongue, bloating, constipation, diarrhea, and usually there's a skin related problem. There are home tests for candida, but I've never found them to be very accurate. There's a series of lab tests that we do to figure out if that's a problem. If you can't quit sugar, then you should suspect candida overgrowth might be one of the reasons why. In addition to candida, there are other pathogens that can exist. They could be bacteria or parasitic typically, so we always want to rule those in or rule them out. You can also have environmental toxins that are damaging your system. You wouldn't think that these would be related, but they are in some ways. In my case, when I had the allergies, I had a bacterial infection in my gut called Giardia. The case study we're going to look at includes a parasite, so you can have yeast overgrowth, parasites, or bacteria. Any of these problems are going to trigger continual inflammation in the gut, so you'll never be able to repair the leaky gut or get the adrenals to work properly while all this is going on. In addition to cleaning up the diet and getting inflammatory foods like gluten, sugar, and soy out of the diet, you also need to test for and clear the pathogens. That's really essential for healing the gut lining. That that's gut lining repair 101. Environmental toxins are another issue you wouldn't think would be related, but there's a really strong tie-in. So the average American has between 400 and 700 toxins in their body. The average baby born in the United States has between 50 and 60 the day they're born. We are all toxic to a certain degree, depending on what our exposure may be and what you've done to pull toxins out of your tissues. I'm going to talk about toxins in a different lecture, but I want to bring it up now because toxins can damage brain cells, and that damage to brain cells can trigger overeating. There's a whole very common problem that we see. So with abnormal brain cell function, the appetite centers are disturbed, so people stay hungry all the time. The same exact thing can happen from a pathogen, and this to me is pretty fascinating. There's all kinds of research on this right now. It's a pretty hot topic in integrative and functional medicine. It's also a pretty hot topic in the regular scientific research world, which is that if you have gut inflammation, the inflammation is going to directly impact your brain. The more inflammation that you have in the body, the more damage there is to brain chemicals. There's actually a very specific pathway that exists that when we're inflamed, we start to make these chemical compounds called cytokines. Those cytokines literally rob us of the ability to produce brain chemicals. The more inflamed your gut is, the more cytokines you're making, the lower your brain chemical production goes. It's just the way it works. In other words, the more inflamed you are, the more you make these cytokines. The very raw ingredients that you make the cytokines from are the same raw ingredients that make your brain chemicals from. So, more information. Brain chemical production drops and people get strange with food. They're very specific things that happen to us when we have low brain chemicals in relation to food. This could be triggered by environmental toxins. The toxins are actually neurotoxins, the ones that we're worried about here. They get into your brain and they physically damage or destroy the brain cells. If a human being or animal is killed, it doesn't really matter how it was killed, whether it was stabbed or shot or blown up. When a toxin enters your body, it's very easy for them to get into fat tissue. Your brain is surrounded by fat tissue. When the toxin leaks into the brain, it slips through the fat tissue protective layer, gets directly into the brain cells themselves, and starts to kill them, basically. You can actually see electron microscopic films of this, the introduction of a mercury molecule and the actual destruction of the brain cell. This is what's happening in our brain from toxins. As the brain cells are damaged, our brain chemistry gets deranged and we start to get really hungry all the time. The same exact phenomena happens with GI tract infections, a different mechanism. We're very inflamed in our gut from the yeast, parasite, or bacteria. Remember that inflammation causes cytokines to go up. The increase in cytokines drop our brain chemicals down, so it's two different mechanisms, but the same effect. One is the brain cell itself gets destroyed or killed, so it can't function properly, so it's dead. The other is that the brain chemicals that should be stimulating the nerve cells in the brain are dropping. A lot of us have both of these problems. This is modern life. You have a lot of toxins like mercury, arsenic, benzene, and DDT in your body, in your food. I don't because I detox all the time, but you might. When I first learned about this, I spent an entire year doing detoxification protocols for my liver every single day. That's how important this stuff is. So you've got the toxins killing brain cells. And if your gut is inflamed, the neurotransmitters, the chemicals that run brain cells, are going to be low. If you have dead brain cells and not a lot of brain chemicals to run the brain cells, you've got a major problem. Think of neurotransmitters as gasoline that would move a car. They're the things that keep the mechanism moving. The brain cells themselves would be like the car. If the car is crushed and you're out of gas, it's not going to be moving anywhere, and that's the situation we find ourselves in. I don't want to be too negative on this, but this is just what happens. With these two problems together, you're going to deplete brain chemicals and then you're going to start to overeat. There's a very specific kind of overeating that happens in this situation. It's not a rational overeating. It's kind of compulsive overeating. It's not negotiable. It's an actual need. Your brain cells are damaged. You need the stuff in order for you to feel okay. It's not a, it would be nice to, it's a, I have to have this. It's very specific and it happens most obviously right after your meals. You just ate a healthy, balanced meal and you're still hungry or you want something sweet. That's another common indication that you might have a problem. So we always want to rule in or out pathogens and toxins in the scheme of doing all this. The two biggest things that affect the gut are pathogens or infections and food. You want to eliminate the inflammatory foods and the pathogens. In terms of the gut lining, that's regulated by our cortisol levels. Cortisol controls the cells that line the gut. The more damage there is to cortisol and the adrenal glands, the more likely the gut lining will be damaged. Stress triggers GI problems as well. Emotional, dietary, inflammatory stresses are going to damage the hormones, which is going to damage the gut lining. Those things are also going to damage the brain. So it's what we call a neuroendocrine problem. Neuro meaning brain and endocrine meaning the hormone producing glands. So it's an integrated system that gets affected here. When we go to correct this, we test and correct the entire system, and that makes sense. We want to test and correct the brain, the adrenal glands, and any other endocrine and the other endocrine glands that are affected, and we want to test and correct the gut. On the gut side, there are two things to do: eliminate the harmful foods and test for pathogens and get rid of all those bugs. On the neuro side, sometimes we work with the brain directly. We always tend to work with the adrenal glands because cortisol impacts gut function. Leaky gut is under control of cortisol. The more damaged your cortisol is, the leakier your gut is. That's because cortisol is what we call a catabolic hormone. It's a hormone that causes things to break down. If you're stressed, your body goes into a catabolic state. You start to break down tissues. One of the first things that you'll break down, in addition to muscle tissue, is the lining of the gut. The more stressed you are, the more damage happens to your gut lining because you're catabolic. You're literally tearing up those intestinal lining cells to use them for fuel. If you're not stressed, this doesn't happen. But if you're stressed and you skip a meal, you eat tons of sugar. If you're stressed and anything negatively impacts your blood sugar, your body is going to become catabolic. It's going to break down muscle and organ tissue, and it's going to break down the lining of your gut. This is why you're stressed. Your gut gets impacted. And as an integrated solution, we're going to test and correct both the adrenal glands and the gut together. So here's a functional adrenal stress profile on the left side of your screen. And we're measuring two major hormones, cortisol and DHEA. The correction of these two hormones is what brings about the foundation of correction for inflammation and everything to do with the hormone system. It's the basis of our hormone system and the basis of our stress response. You can see the reference ranges off to the right. This patient is low in the morning, low at the noon hour, low in the afternoon, and normal at night. Her total cortisol is 10. It should be closer to 30. Her DHEA is down at 1. It should be closer to 5, 6, or 7. When we're first under stress, cortisol levels go up. Over time, the cortisol levels drop. When we're first under stress and cortisol goes up, we get catabolic, so we break down the gut lining and the muscle tissue. When the cortisol levels drop in more advanced stages of adrenal burnout, the gut lining gets more and more damaged. This is what we call, in technical terms, a stage 3 adrenal, where the cortisol and DHE are both low. With a stage 3, it's very likely that there's been a large amount of gut lining damage for a long period of time. If your cortisol levels are low, it means you've been stressed for a long time and your adrenals have burnt out. So as the adrenals burn out, the gut lining is going to come down with it. It's dragging the gut lining down, and then you start to see all of these infections. This particular patient has a parasite called Blastocystitis hominis and a yeast overgrowth with the Candida marker showing up positive. The more inflammation that's in there because you're eating the wrong foods, the more likely you are to pick up these infections. So once they're there, we have to treat them, although they're not necessarily the original problem. How does this all come about? We're under stress, emotional, dietary, inflammatory stress. We're eating the wrong food. The gut is inflamed. The hormone system has fallen apart. The brain isn't doing very well either. We can't stop eating the wrong things because we're being driven to eat the wrong things because our brain chemicals are low and because our blood sugar is unstable from all of these problems. It's a downward spiral, and then the GI problems start to develop. It is very rare to see a digestive problem out of the blue. It's possible, and I've seen it a few times, but it's extremely rare. 99.98% of the time, people have advanced GI problems like this lab shows. It's very rare to see the exception to that. Sometimes you might have a person where their original trigger was a food problem. Maybe they grew up eating too much sugar and tons of gluten and they're sensitive to both. And all that damaging food weakened their cortisol response, weakened the gut lining, and then they picked up a bunch of infections. You could have a situation where you're under a huge amount of stress, you're going through a big problem at work, so your adrenal glands are suffering, and that leads to a weakening of the gut lining, and you pick up these infections. Once this ball gets rolling, it's going downhill really quickly and really negative way. The gut problems eventually feed back and start causing the brain problems, as well as the gut problems themselves triggering all this inflammation. So remember, when you're inflamed, cytokine production goes up, brain chemical levels are dropping, and when you're inflamed, cortisol gets taxed even more because it's an anti-inflammatory hormone. Cortisol is regulating the immune response in the gut. If cortisol is off, you're going to have a gut problem. You have a gut problem that's going to cause inflammation and dysregulate cortisol even more. We want to try and break that cycle. That's the whole goal of the treatment and why we test. So you can see where all this is going. If you wanted to solve all of this, what would you do? You would want to reduce inflammation through dietary changes and lifestyle changes because that's usually one of the original triggers. If you're really stressed out of your mind and you're working 100 hours a week, and I do have patients who work that much, which is remarkable. If you're eating pro-inflammatory foods all the time and working 100 hours a week, we want to start your treatment by getting you to work 50 hours a week and not eating inflammatory foods. Treatment always starts with diet and lifestyle changes as the initial way to get things rolling. Then we work with the adrenal glands. Why do we work with the adrenals? Secretory IgA is a fancy way of saying the immune response in the gut lining. We want to strengthen the immune response in the gut lining by improving the adrenal glands. That's the next step. This third step is to kill the bugs in the gut and get the GI system to repair. Lifestyle leads the way, cutting down on inflammation, reducing emotional stress, fixing the adrenals to strengthen the SIG-A, to strengthen that gut lining, to stop that leaky gut from happening. Then we kill the bugs, and eventually, at the end of the process, we repair the GI tract. This just takes planning and thoughtful follow-through. Does it work all the time? Yeah. If you do everything right, it works all the time. Life gets in the way. People die or move. People can't figure out how to change their diet. Lots of things happen that would make it not work. But in general, if you're following through and you're going in the right direction, these protocols for the vast majority of people work. Where it gets hard is how to implement them all. Some people can't change their diet or can't stop working 100 hours a week. Some people can't figure out how to do the adrenal programs or they skip that step. If you're not setting the person up properly and you're trying to kill the bugs right away, you ignore the lifestyle changes and the work on the adrenals, you greatly diminish your odds of any of this working. So the biggest fallacy that I see for all of us, including myself, is that you have a gut infection like candida or parasite. You think that I just solved that particular bug problem and everything is going to get better. You don't realize that there's a reason why that occurred in the first place, because the adrenals were burned out. The lifestyle changes weren't working for you. We want to go back and have a complete treatment plan that addresses each level of the problem in order, not just the current issue with heartburn, for example, but also address what you were doing that created the problem in the first place. Lifestyle changes first, strengthen the adrenals second, get the immune response in the gut working great, start to reverse the leaky gut, then kill the bugs and repair the GI tract. That's the basic order you should be doing all this in. If you know the right sequence, it works beautifully, but people do it backwards. They try to kill the bugs first, and that's just not going to be effective. And if you do have some resolution of symptoms, it will be temporary and you will backslide and things will come back. There is a very specific way that the body breaks down, and we need to go back and treat in the order in which things occurred. It's very important. So if you are interested in becoming a patient, you can go to the digestivehealthcenter.com. If you want more information or have more questions, I offer free discovery calls for residents in California and Colorado. Hopefully, this will be another piece of information in your overall picture of how this works. Just remember that there are 3 body systems: the adrenals, the gut, and the detox. We want to get all 3 of these body systems working in order for people to be healthy, along with lifestyle changes. I have had all of these problems myself. I had major gut problems for 16 years, so I can totally relate to your problems. If I had heard this lecture when I was 33, it would have saved me 16 years of self-treatment and doing things in the wrong order. This is basic stuff, but it's not well known by the general public. So one of my missions here is to get people educated. So thank you for your time. I hope you enjoyed this. Don't forget to book a free discovery call and see how I can help you. Thank you.